Okay, my name is James Park, and we are here to do the cardiovascular exam. My patient here, LP, do we have your permission to do an exam and you can upload it to publicly for YouTube viewing?
Yes.
Okay, great. So the first thing we're going to do, or what we would do, we'll just talk about it, is going to be we're going to have the patient lay supine. We're going to do their blood pressure. We would do it on both sides. Then we would record that. We would have them seated or standing. And then we're going to record that again and see if there's any discrepancies or changes in the blood pressure. So that's the first step we would do. The next thing we would do is we're going to check for jugular venous pressure. And to do that, we're going to have the patient turn her head to her right a little bit. Yeah, actually to her left, excuse me. Good catch there, patient. We're going to look for the jugular vein and pulsations there, and that's why we turn their head, and when we look for it, in a normal healthy person, it's going to be midline or lower, kind of to the suprasternal notch, and right now, I'm going to see it right here, I'm seeing it right here. And so to do, next thing we would do would take a straight edge, which would be this, and then we're going to measure up from the sternal notch, and that would be something like this. And here, inches. Okay. And that looks like 1.5 centimeters. So anything lower than 3 centimeters is normal finding. So that's what you're looking for when you do that. Okay, so put your head back in midline there. Patient's head is in midline. Next thing we're going to do is we're going to palpate the carotid arteries, and we're looking for the volume and tympany. Palpitations and upstroke. So you're going to do that. Palpate on the left. Or right. Now or left. And feeling for that upstroke. Upstroke is after S1 and just before S2. So that's what you're palpating for right there. And then the next thing we're going to do is we're going to auscultate the carotids. So take your stethoscope. We're going to do this with the bell and the diaphragm. We're going to do it bilaterally. So you would take it here. So on that, you're looking for any turbulence or bruise. That's basically what you're looking for on that. Okay. Next. Okay, we're going to go here. All right. So you could sit up if you wanted, please. And we would inspect your chest and precardium for any abnormalities. Pulsations, basically that's what we're looking for on that. You're going to palpate the second on the right, patient's right, intercostal notch for the aortic. You're going to go over pulmonic. Then you're going to inch your way down, Erb's point, which is the third, fourth, and fifth intercostal space. And then, raise your breast, it's right under here. It's going to be the apex of the heart, which is your mitral. And so again, you're just looking for pulsations, any abnormalities or pulsations. Okay, thrills will be any turbulence or abnormal flow through the system. Okay, and then we're gonna auscultate. We don't do any palpation on the chest because really there's no need to. When females' breasts are in the way, the males you don't really feel it, so we're not doing that anymore. But this way we're gonna do auscultation of the same points: pulmonic, aortic, aortopulmonic, tricuspid and mitral, and Erb's point. And so that's going to be both with the diaphragm and with the bell. So you're going to do it over here. Pulmonic, Erb's point, and mitral, which is the apex. And then you would switch over. Do it with the bell, same point, second intercostal space. On the patient's right, on the left, third, fourth, fifth. And the apex or mitral. So that's what we're looking at there. You're looking for also a split S. A split S is where the pulmonic and aortic valves don't open and close at the same beat or at the same time. So a split S would be when it's broken up. Okay. Okay. Okay, so I'm gonna have you lay back face up again, please. And we're gonna do auscultation of the abdominal aorta with the diaphragm and the bell, and then we're going to move down to the iliac, arteries, renal, and kidney. And femoral. So it's going to be just left here. Pick that up here. You should be able to hear that. The flow and the rush. Which I do, actually. Looking for the bifurcation where it goes into the renals, right and left. With the diaphragm. And femoral. Okay, so there we go. We got your abdominal aorta. That's the auscultation. You can palpate that. The abdominal aorta. You should be able to find it and palpate that. Looking for bruits once again. So, that's pretty much it on that. Then we're going to go to the extremities. And the first thing you're going to do is going to look at all the extremities, and you're going to feel it for warmth and look at it for color. And it should be normal, pink, and warm. So you do that on all four extremities. Start at the top, go all the way down. She's got shoes on, but basically that's it. You're going to look for clubbing in the fingers, so that would indicate any cardiovascular problem. You're going to push down. Basically look for any clubbing, but capillary refill, you're going to push down on the nails and look for the color to come straight back. And so you do that on all four extremities. Right here and here, all over here, and all over here. Okay? All right. Next, we're going to do pulses. So we'd start with, let's do radial pulse. You're going to get the radial pulse on the patient's right. You're going to get a radial pulse on the patient's left. And then brachioradialis, which is just on the lateral aspect of the brachioradialis muscle. It's on each side. That's what you're going to look for. So the pulses on the upper extremity, so that's going to be your radial and brachioradialis. Those are 2 plus. And then you got your femoral pulses. This should be palpable here. And the inguinal ligament on both sides. And then you're going to do your popliteal pulses. There's going to be, bring your fingers together and just separate them out just a little bit. You're going to wait and feel that. Patient's right and left and right. And then your dorsal pedis pulse. It's basically going to be right off of here. Just medial and distal to the ankle bone, fibula. Okay, so you're going to have dorsal pedis, your popliteal and femoral pulses. They are all 1 plus. Okay, so lower extremity 1 plus, upper extremity 2 plus. And then you can do a Homan sign, and that's where you dorsiflex the foot and look for the patient to jump. Any pain in the calf area or any aggravation, but it's really a non-specific test. It's just you're just looking for, it's supposedly for DVTs, but really it's not a specific test. But you could use it to indicate and get some other diagnostic testing if you need to. So, okay, I believe that covers the whole exam. Split S. We got the split S. Check the precordial area. No pulsations. Spine, jugular veins, palpation. Okay, I'm going to say that that's it. Let me put my patient up here. And there you go. Thank you.